Welcome to this session. In this, we're going to cover stents. We're going to explain stents and angiogram as well. What is a stent? A stent, as it's often called, is a coronary stent, a tiny wire mesh as shown in the picture that is essentially tube-like and inserted into the arteries during the procedure called as angioplasty. The stents stay in the artery permanently. So the infusion, as the arteries narrow, the stent is one of the technique to be inserting into the artery so as to ensure the passage of the blood flow happening at a normal pace. And this is going to stay there forever. The stent will also improve the blood flow, which is its core purpose for the deployment in the artery and the muscle, and will relieve of the chest pain, which is referred as angina. Catheter insertion. This is one of the procedures that is involved by the skilled experts who are cardio specialists essentially. They perform this procedure, and this is used to diagnose and treat certain cardiovascular conditions. We're going to understand more of it. In this process, a long thin tube called as the catheter is inserted into the artery or the vein in the groin of the individual, neck or arm, and then threaded to the blood vessels of the heart. The catheterization showing the retrograde filling of the dye to PA basically, and which is pulmonary artery, and from the dilated circumflex coronary artery through the corona to pulmonary fistula in the aortic diagram. We're going to see even more advanced visuals, but this gives you a perspective. Though it is little technical in nature, you got to understand from a procedural standpoint what is involved. The dilated circumflex artery and the fistula. As you can see here in this picture, you have the complete understanding of the left coronary artery that splits into two forms of the left anterior descending artery, referred as commonly LAD, and the circumflex artery itself. And the black and white picture shows you the LAD, which is the left anterior descending coronary artery on the periphery to the top right. You see that. And essentially, the dilated circumflex coronary artery is having 6 segments, as you can see more clearly in the black and white visual, and the more how the inner side of the heart is looking like is depicted in the color picture. So this has 6 core segments, and one is the proximal circumflex, which is referred as PC. The second is the obtuse marginal branch, OC, and then the distal circumflex, DC, and it is essentially the posterior descending branch, as you can see at the bottom that it is moving through right here in this region. And next you have the intermediate branch, which is the IM here, that's shown in the dotted lines, and then you have the posterior descending branch PD as well here, that's depicted in this bottom side of it. And the DC, as you have seen earlier, is the distal circumflex. So this gives you the perspective of the different segments that are associated, though it's little intensive. Just to give the perspective what kind of condition is explained, at least you know the contextuality, how to interpret it or gain the perspective. Now, as the artery is completely blocked, then it will cause the heart attack or the myocardial infarction to happen. And when this happens, the heart muscle that is getting the blood is blocked and the artery dies. So basically, so this is an urgent medical condition has to be attended so as to relieve the person from this. At times it could be fatal, so the timely intervention cannot be emphasized more, and its need not of the hour but by the minute. So moving further, what is angiography? Let's briefly gain a perspective on that as well. So as you can see here, the coronary artery blockage is being addressed with the angiogram. And angiography or arteriography, as it's called in the medical imaging technique, which is used to visualize the inside or the lumen of the blood vessels and the body organs of the body with particular interest in the arteries, then the veins and the heart chambers. So the color is reflected because of the medical imaging techniques. Certain dyes are induced. So as you have seen the black and white contrast picture of the complete veins are coming through, just like the X-ray you see the bones. Now you can see the arteries and the veins by inducing the contrast dyes. And these are done by super specialists, and they have to be engaged to do such advanced procedures. And it's a life saving exercise. As the angiogram is essentially a diagnostic test similar to that of X rays to take good pictures of the blood vessels, and a long flexible catheter, as you have seen in the earlier picture, is inserted through the bloodstream to deliver the dye, that's the contrast agent as it's referred to, into the arteries and making them visible in the X-ray. And this is relatively a procedure based on the use case scenario which we'll discuss will be performed, and the test will help in diagnosis A, the stroke, aneurysm, and of course arteriovenous malformations, any tumors, clots, and then arterial stenosis. Why is angiogram done? So your doctor may recommend that you may have the coronary angiogram if you have one, the symptoms of coronary artery disease such as chest pain, angina. Number two, if you have pain in your chest, jaw, neck, or arm that can't be explained by other tests. Third, you have new or increasing chest pain. Basically, it's an unstable angina condition. Fourthly, you have a heart defect when you were born. This is congenital heart disease. For almost 75% of the people, for example, there could be whole, but initially few weeks after the formation, it's going to plug in itself. For some people, it's going to be open and continued. This is just one of the examples of such a congenital condition. Next, you have the abnormal results from the non-invasive heart stress test, or it could be the blood vessels problems or a chest injury that would have happened, a traumatic injury, for example, a heart valve problem that requires a surgery. So these are various conditions. Since the use case scenarios are different, so based on each of the specific cases and the related attributing factors, the doctor would make the appropriate recommendations as to what angiogram has to be performed and for what purposes, and what it's going to take. It's a relatively straightforward procedure now these days with the technology advancing, and the millions of people who have availed this procedure over time. Angioplasty. This is a procedure to open the narrow wall and that are blocked by the blood vessels that supply the blood to the heart. So these blood vessels are called the coronary arteries, as we have seen earlier as well. The coronary artery stent is a small metal tube that expands inside a coronary. So using the different balloon type of technique, for example, this stent is put into the artery. A stent is often placed during or immediately after the angioplasty, wherein now we'll see it shortly a balloon angioplasty or the percutaneous transluminal angioplasty, PTA in short, is a minimally invasive endovascular procedure used to widen the narrowed or the obstructed arteries or veins, typically to create the arterial atherosclerosis. Now, the angioplasty procedure, as you have seen through a, it the wire initially it goes through, and along with the wire, now the angiogram is used to the position a balloon catheter, and then the next step would be to pass the guide wire into the narrow vessel and then inflate it to a fixed size, and this balloon forces the expansion of the heart vessel and the surrounding muscular wall, evolving as an improved blood flow. So, as a result of the ballooning, there is now more space around which now more blood can flow through, creating that improved blood flow in the process. A stent is then inserted at the time of ballooning to ensure that the vessels remain open and the balloon is then deflated and withdrawn. So this angioplasty has to include all the manner of the cardiovascular interventions that are typically performed percutaneously. As you can see in the picture, the balloon is inflated and crushes the plaque within the artery wall. Now, when the stents are deployed, the balloon, as you have seen earlier, it has expanded, and now the wire gauze mesh is put through, and then this metal is very stable and it will stay there almost permanently, and it adjoins with the inner lining of the artery, and definitely certain high specialty is needed. Now you can understand the super specialty that's needed by the cardiovascular surgeons to the interventionists. Now, what is DES? It's essentially the drug-eluting stents. This is another variety of the stents that have the polymer coating over the mesh of the wire that is put through so as to emit a drug over time to help the blockage from coming, not to come back, essentially. So once you have realized the blockage is circumvented with the stent, and then the polymer coating with the drug that gets diluted, and it protects basically so that there is no blockage formation again. It depends based on the specific scenario, the choice of stents are laid out. This is only to explain you what are the choices available, and based on the medical conditions, the experts would make the determination how and what has to be used. And dilute these eluting stents are preferred over the bare metal stents for some most people, but as I said, they are based on the conditions, you got to adopt that, and the drug eluting stents are more likely to keep the blockage from reoccurring and compared to that of the bare metal. So as the drug percolates over timeline, so in the medical world, it's very similar to what do we say, mainly on the drug purposes. So, over extended time with the delayed, the drug would percolate through the system, and this would give the right dosage and the effect that's needed so as to ensure the blockage does not happen again. So the extended release mechanism is a subset of the stent that is being inserted. So as you see, these DES are coated with a medication that is slowly released. So it's called extended release in the pharma world, and diluted to help to prevent the growth of the scar tissue in the artery linings. This helps the artery remain smooth and open, ensuring a good blood flow happening. Many people with the heart problems have been successfully treated with this drug eluting stents DES, and preventing the need for more invasive procedures. So this is less intensive but minimally invasive and much faster to be done, but it depends upon the choice. The early stage intervention would allow to put the stents instead of doing the complex surgeries after the infraction. And as you can see, this the coronary artery instead of the bypass or the dilatory stents could be leveraged to prevent the recurrence of the symptoms, especially angina or the chest pain. And this also reduces the need to repeat the angioplasty procedure, which carries the risk of complications of even the stroke or heart attack. As you can see, the slowly extended release drugs that keep the artery from narrowing again, and this process is called as the stenosis. So what are the options for treating the clogged arteries? One, you have medications and lifestyle changes. Two, the angioplasty and bare metal stents. Three, angioplasty and the drug eluting stents. Fourth, last choice would be corona bypass surgery. So these are the various options to treat the clogged arteries in the heart. So this gives you a perspective what are stents, angiogram, angioplasty, and what are the options on the table, and what are the type of procedures or the interventions done. So thank you very much for your perspective and your attention. And to gain more information, you could get to this contact info or the website and download other information. Thank you very much for your attention and look forward to see you again. Thank you.